Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, bronchitis. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will delve into the intricacies of bronchitis, including its definition, etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of bronchitis and its impact on patient care. So, let's begin. Let's start with what is bronchitis. Bronchitis refers to the inflammation of the bronchial tubes, specifically the large and small airways within the lungs. This inflammation results in coughing. Bronchitis can be classified into two main types: acute bronchitis, which lasts from a few to 10 days. Cough may last from 3 to 6 weeks afterwards. And chronic bronchitis, which is characterized by productive cough that lasts for 3 months or more per year for at least 2 years. In more than 90% of cases, the cause of acute bronchitis is a viral infection. These viruses may spread through the air when people cough or by direct contact. Viruses that cause bronchitis include influenza virus, rhinovirus, and respiratory syncytial virus. Bacteria that cause acute bronchitis include Bordetella pertussis and Mycoplasma pneumonia. Risk factors include exposure to tobacco smoke and other air pollutants. Viral and bacterial infections mainly cause acute bronchitis, whereas tobacco smoke and air pollutants cause chronic bronchitis. The signs and symptoms of bronchitis can vary depending on the type and severity of the condition. However, there are several common features. In acute bronchitis, common signs and symptoms include cough, which may or may not produce sputum, coughing up mucus, wheezing, shortness of breath, fever, and chest discomfort. The infection typically lasts from a few to 10 days, with the cough persisting for several weeks. Key signs and symptoms in chronic bronchitis include a persistent cough with sputum production lasting for 3 months or more per year, frequent respiratory infections, shortness of breath, wheezing, fatigue, and cyanosis, bluish discoloration of lips or nail beds. The pathophysiology of bronchitis involves mucus hypersecretion and inflammation of the bronchial tubes. In acute bronchitis, viral or bacterial infections trigger an inflammatory response, leading to swelling of the bronchial linings and increased mucus production. In chronic bronchitis, long-term exposure to irritants causes an increased number of goblet cells and enlarged submucosal glands. This results in excess mucus production, thickening of mucus, and chronic inflammation of the bronchial tubes. To diagnose bronchitis, healthcare professionals may utilize various diagnostic approaches, which are medical history and physical examination. A detailed medical history and thorough physical examination helps to identify the duration, nature of symptoms, and exposure to respiratory irritants. A chest X-ray may be useful to detect pneumonia or rule out other underlying respiratory conditions. In some cases, a sputum culture may be performed to identify the presence of bacterial infection and guide targeted antibiotic therapy. The management of bronchitis aims to relieve symptoms, reduce inflammation, prevent complications, and improve overall lung health. For acute bronchitis management, treatment focuses on symptomatic relief and includes rest, over-the-counter medications for fever and discomfort, and staying hydrated. Antibiotics are generally not recommended unless a bacterial infection is confirmed. For chronic bronchitis management, lifestyle modifications are crucial, such as smoking cessation, avoidance of respiratory irritants, and maintaining a healthy lifestyle. Medications may include bronchodilators to open the airways, inhaled corticosteroids to reduce inflammation, and antibiotics for acute exacerbations. Pulmonary rehabilitation and long-term oxygen therapy may be recommended in severe cases. In conclusion, bronchitis is inflammation of the bronchi with acute and chronic forms. It is caused by viral or bacterial infections in the case of acute bronchitis and by prolonged exposure to respiratory irritants in the case of chronic bronchitis. Timely diagnosis, appropriate management, and lifestyle modifications are essential in improving outcomes and maintaining lung health. For more videos like this, please subscribe to our YouTube channel and visit our website madeformedical.com. Link is in the description. Thank you.